welcome in to All Things Odd. I'm Dr. Natalie Phillips.
I'm Dr. Hannah Galloway.
And I'm Rebecca Crowder, the fourth year Audiology extern.
So we have decided to do our show once a month. So you'll find us on the second Thursday of each month at 12:30 p.m. Mountain Standard Time still. And we will be able to have some time to bring you some good topics, or if you always have some good topics or something that you want us to talk about, then we want to make sure that you are able to do that. I forgot to pull up our YouTube channel, but you can scan that little QR code there and you can find our links to our Facebook, our Instagram, and our YouTube channels. So you can follow us and you will be notified if you hit the notification button on YouTube when we have a new episode dropping. So we typically go live on Facebook and on YouTube and on my LinkedIn profile as well. So today, what we thought we'd talk about is common questions about health insurance. And so we had decided to start this topic because I had actually gone to a eye appointment, and I came back and I talked to Dr. Galloway and Rebecca and also our staff, because I was really shocked, but also not shocked that when I checked in, they didn't take my vision insurance or VSP. But the more that I dived into it, it's because that particular benefit, which, everybody knows what a VSP benefit is, right? Sometimes it helps with your glasses or cost of your glasses or cost of your contacts, but it doesn't pay the practice very much. And that's what they explained to me. So I totally got it. But then I was shocked that they didn't take my vision insurance, because that's something that's different. And the only thing that they took was health insurance. And so we had talked about it. I think Dr. Galloway had another patient this week. And so we were talking about it, and it was top of mind. So we decided that we should maybe talk a little bit more about health insurance issues and things that people are just asking when they come into our office. So that's kind of what spawned our discussion for today. And hopefully we'll give you some information of what comes up to our office pretty often. So one of the things that I'm going to start with, and then we will move on because everybody's kind of got a question to cover, is what insurances do you take, and can I be seen if you don't take my insurance? And so this comes up a lot because, we do actually take Medicare, Medicaid. And then we did, when we first started in 2021, which I can't believe it's 2026 now. So we've been open, we're going on our 5th year. We did take Blue Cross, Blue Shield, and United Healthcare. And at the time, Cigna and Aetna were not able to take on new practices and providers. And so basically, we were just contracted with Blue Cross, Blue Shield, and also with United Healthcare, along with Medicare and Medicaid. And so what's interesting is now we only take Medicare, Medicaid, and United Healthcare, because last year we actually dropped Blue Cross, Blue Shield. And I know a lot of people come in and they're all freaked out because they're like, oh my gosh, I want to see you, but you don't take my insurance. Well, bottom line is, yes, we don't take your insurance, but if you have out-of-network benefits, we can still see you though, right? So that's one option of seeing you. We can still see you if you've got out-of-network benefits. So you just have to call your insurance company and say, hey, do I have out-of-network benefits? If you do, then you can come see us. The second thing, though, too, is you can always come and see us. And we do have self-pay. So if you're going to bypass your insurance because your insurance happens to not pay for it, or we're not contracted, or you don't have out-of-network benefits, you can still see us. We have a self-pay discount that we apply. And a lot of people have done that. So we're getting comments actually here. So we've got some people coming in just saying hello. So great to see you. So glad for you to join our show. If you've got questions or comments or anything like that, put it up here. We'll try to see if we can actually get to your question. So thanks for joining you. We have a lot of people watching actually. Mm-hmm. Okay. So with that, that's what my question was about, is that we take certain insurances, but we're still able to see you even if we don't take your insurance. Okay, so then we're going to go to the next question here, and I'm going to pass it over to Rebecca.
Mm-hmm. So the question that I was kind of given today is that if you're a patient and you have Medicare, what do you need to do to be seen by our office? So Medicare Part B that we are going to talk about a little bit today essentially covers the cost of diagnostic testing as long as it's medically necessary. So that diagnostic testing does include a yearly comprehensive hearing evaluation or balance testing if you do need that. So that's considered the way that we get that considered medically necessary is that hearing tests for Medicare patients do require a referral from essentially your medical provider. So it needs to be a primary care physician, a nurse practitioner, or a physician's assistant. And the nice thing about it is it's not a big task for you to achieve or get this referral. Often it can just be obtained by putting a phone call into your provider's office and saying, hey, I'm due for a hearing test. I'd like to go to Audiology Center of Northern Colorado. Would you send that over? So a lot of times just a phone call request is enough without actually having to go in and do an office visit, but you shouldn't skip your yearly office visit. And if you happen to be at your office visit and you're realizing, I probably need a hearing test, you can also ask for it at that time as well. So if you come into our office, you've got your referral, we do your hearing test, and then we find that, your hearing loss kind of qualifies you as a hearing aid candidate. There's a couple important things that you should know about Medicare coverage for hearing aids. Your typical Medicare Part B will not cover hearing aids. And sometimes that can be a shock when you're coming in and you're thinking that, Medicare, well, this is my healthcare service. It should cover this device that I need. A lot of times, actually, I should say clearly is that Medicare doesn't typically cover hearing aids under Part B. Now, if you have a Medicare Advantage plan, a Part C, sometimes there can be a hearing aid benefit associated with it. But the benefits are not always clearly defined and often have a lot of limitations. Just to give you a picture of it, those Medicare Advantage plans, they're offering hearing aid benefits, but the benefits, they're not standardized across Medicare Part C plans. So that means that one patient comes in with their Medicare Advantage and they may have a certain benefit, and another one comes in with their Advantage plan and they have a completely different benefit. So that's one of the problems that we do run into, is that it's not an easy, well, you get this every time. It just really does vary widely by the plan that the individual patient has. The carrier that's you're associated with, and even sometimes where you're located geographically. And then the other caveat is that those plans can change yearly. So you may have had a benefit in the past, and then you no longer have one. I was talking with Dr. Galloway, and we were looking at insurance benefits for some patients who wanted to use their Medicare Advantage. And this patient, unfortunately, didn't have a benefit. And usually when Dr. Galloway runs it, usually the Medicare Advantage will show that they do sometimes have a benefit, but it's changed in the last year. So that's just something to be aware of, is that even though you might be told, or it might be advertised that you have a hearing aid benefit, it can it can vary widely, and then it also might change year to year. The other limitations that come with those Medicare Advantage plans are kind of dollar caps, in the sense that a lot of those Advantage plans may only give you a $300 to maybe only up to $1,000 to put towards those hearing aids. And if you've ever shopped around, you know that these devices, because they provide a lot of benefit, they can be very costly. So sometimes that benefit going through that Medicare Advantage often doesn't cover nearly enough of what you need to purchase a quality set of devices. And then one of the other things that kind of comes along with some of the Advantage plans for that hearing aid benefit is they require a mandatory use of third-party vendors or contracted networks. So even if they do have a significant benefit, you're required to visit who they have selected that you have to go to. And that can be not necessarily a problem, but there is the chance that you run into device limitation and selection at those third-party places. A lot of times the Medicare Advantage might only cover a basic or a mid-level technology, which you can get by with certainly, but there are certain hearing losses that require or really need something more premium or more advanced. And the other thing that can happen is sometimes the hearing aid benefit might be there, but the cost of the follow-up care may not be. So you might have to go every time you go in, you've saved on the hearing aids, but you haven't necessarily saved on adjustments in the future or parts and pieces and things like that you need. So, a lot of times we see patients assume that coverage means it's going to be a minimal out-of-pocket cost, but they often still face those significant expenses for the follow-up care. And they're really limited on time with their providers in some of those situations as well. So for audiologists, the limitations really do kind of bridle what we can do on terms of a quality of service, and they really reduce the ability of providing the best devices for the patients in some situations. And our goal here, I'm pretty certain they would both agree with me, is that we want to provide you excellent care by providing you a quality hearing device that's appropriate for your hearing loss first and foremost, and then also provides you the best performance in order to maintain your quality of life. And a lot of times, that limited device selection with a basic or a mid technology level will only scratch the surface of one of those needs and may not be the best option for you. And so if you're dead set on using that Medicare Advantage plan, you might be limiting your overall experience and quality of device that you can obtain. So hopefully that kind of answered, it's a lot of information, but hopefully that answered kind of how traditional Medicare Part B follows for diagnostic testing and what you need for it. And then how some Medicare Advantage plans, Part C, might cover the hearing aid cost for you, at least just a tiny bit of it.
Yeah, it's a lot of information, but we're going to keep going over it, I think, as we continue through some questions and a few scenarios as well. So thank you. Okay, so then now we're going to head over to another question here for Dr. Galloway.
All right. So the question is, my insurance says I have a benefit for hearing aids. Does that apply to your office? So it's never an easy answer, unfortunately, because it depends on what insurance you have. Medicare, like we just talked about, does not typically cover hearing devices, which a lot of patients are surprised, to find that out. Actually, I had a patient this week and she said, "What do you mean? Isn't that mostly older people?" And I was like, yeah, it is. And that's why it's, I was in graduate school before I learned that hearing aids were mostly like a self-pay situation for seniors, which is unfortunate. So with Medicare, there's not going to be, hearing aid benefit, traditional Medicare. The advantages Rebecca kind of just talked about, and those, they change all the time. There's different servicers. So there's like one through Cigna, there's one through United Healthcare, there's all these different ones. So we don't have as much of a pulse on those because there's so many different ones, and they've changed a lot in a short amount of time because they haven't been out for, that long. And for Medicaid in the state of Colorado, hearing aids are paid for children, but not for adults. So that one is straightforward. If you're 21 or younger, your hearing aids will be paid for by Medicaid. If you are older than 21, they will not be paid for. And then I know Dr. Phillips had kind of brushed over, what insurances we're in network with. Right now, it's just United Healthcare that we're in network with. And so some plans have insurance benefits. Some of them will, pay up to a certain amount for hearing devices. And then some plans do this thing where they make you work with a third party. And so it's lucrative for the insurance company because essentially they make more money selecting these third party vendors and, taking care of which hearing aids are available and or not. And overall, between the traditional or between the commercial United Healthcare plans and the ones that dictate that you use their third party United Healthcare hearing, the reimbursement is very different, which we're providing the same service for the same insurance company for just a different patient. So why would we get reimbursed, a vastly different amount for that? The other thing is with some of those third parties, there's only certain devices you can get. There's only certain providers you can see. One example is children. Children should be seen by an audiologist. They should not be fit by a hearing instrument specialist. But a lot of these third parties, they might not have an audiologist available. And I had a mother call several offices, and there wasn't anybody that was going to be able to fit her child. So it doesn't work for everybody. It's kind of more like your standard, run of the mill, mild to moderate hearing loss that, and then there's a few devices that can handle that. But for a lot of our patients, they need a different option. Maybe they have single-sided deafness. Maybe they, have that progressive hearing loss. Maybe they have like some other things going on. Maybe they're thinking about surgery. So we see a lot of patients that just don't fit in those boxes. And we do not work with third parties. That's just something that we decided as a business that we want to give the same level of care to everybody. And it's excellent care. And that doesn't fit in those models. So unfortunately, we've just had to not accept those. I think with United Healthcare, it's really confusing because if you look us up on the United Healthcare website, we're in network as providers. But your plan might dictate that you get your hearing aids from United Healthcare Hearing that we do not participate in. So that's been really confusing for patients. And I think that the naming structure of all of it is confusing. And so we do a lot of educating in our office of just, what the benefits are, what that means. Sometimes they'll say, oh, 80%. Well, it's not just 80% of whatever you charge them. They have a cap. So there's a allowed amount. And Dr. Phillips and I were talking. I went to another specialist office. I went to a periodontal office. And, at the end, they were talking about costs of the procedure and all of this. And they took me into this little room to go over all the costs. And, she starts her whole conversation about allowed amounts of insurance companies, which is something that we know all too well. And we have to answer those questions for people. So I think patients are facing this in a lot of different areas, especially for specialized care or somebody that's really in demand as a provider. If patients are lining up to schedule with you because you're excellent, you can say that you're only accepting cash pay or you're not, taking the certain insurance or whatever. And so I think, especially in our area, there's a lot of patients who have seen this elsewhere, whether it's at their primary care office. A lot of things have changed with Blue Cross, including, the change that we had with them. So I think that patients are getting more savvy and they're learning to understand these things better and kind of just get more information and, be exposed to it. So that's why we kind of want to talk about it. It's not just audiology that, has that. It's vision and dental and, primary care and surgery and all this stuff. So that's kind of, it's not really straightforward. If you have Medicaid, it is straightforward. If you have Medicare or private insurance, it's not straightforward, but we would be happy to check for you, look it up, tell you what we can find out about it, about what your benefit might be.
Yeah.
Or if you have one.
So as we're kind of talking about common questions, we're going to go into some scenarios, and it might kind of overlap a little bit because it's something that we have to deal with. Like Dr. Galloway said, we're doing a lot of educating here in our office. I do want to kind of pause just real quickly because there's a couple of reasons why people still come to our office, whether or not we take their insurance or not. We get a lot of recommendations from physicians here in Fort Collins because we are not a typical audiology practice. So in addition to our diagnostics for hearing loss and fitting hearing aids, we're also able to do, as you've seen our shows, work with physicians for bone-anchored hearing aids and cochlear implants. We can do tinnitus and sound sensitivity. We do balance and dizziness testing and evaluations, auditory processing, and then also just kind of having these referrals with a brain concussion specialist, right? And so there's a lot of things that we can do. So that's number one, why even insurance or not, they're still willing to come here because we have the experience to see all these types of patients. The second thing I wanted to talk about real quick too is, we're talking a lot about hearing aids because that is one of the things that we educate a lot of patients about is coverage for hearing aids. But I do also want to pause to let you know that in our office, like we are dedicated to help you find a solution. So we know how much hearing aids can actually bring you back and connect you back to your life and to your loved ones. And so whether or not you have insurance, we have ways to figure out how we can get something that's affordable to you. We get a lot of donations. We have our own nonprofit organization. Again, if you follow us on social media, you know that we started our own nonprofit organization, ACNC Cares. And so we have a board. And so we are collecting people that might need hearing aids and we'll get it approved by our board and get donations from manufacturers. I'm trying to think what else. We also work with other organizations like the Hearing Aid Project or the Hear Now Project, right, with Starkey. So there's a lot of different possible other ways to help you get into devices that you can afford. We used to work a lot with the Larimer County Hearing Aid Bank as well, but I know that they've got a lot of backlogs. So don't be afraid to ask questions, and don't be afraid to think that, you know what, I just don't have the money, so I'm not going to be able to hear well, because that's not entirely true. We want to make sure that we help you out and that we're going to help you find something so that way you can get into being able to hear other people and have conversations. So just wanted to add that real quick as we're going through these common questions and just kind of talking about educating the public about our practice, but then also what we're dedicated to as well. So we're going to go on to the second little section of what we had kind of planned, which will kind of overlap as well, about common scenarios with health insurance. And these are just some things that off the top of our head, we kind of collaborated and we're like, okay, well, this is what we kind of see maybe on a weekly basis coming from patients that come into our office. And the first one that I'm going to talk about is, I have Medicare and AARP, and it says that I have a benefit for hearing aids. Can I use it here? Well, interestingly enough, I did look up AARP because, going over what Rebecca had covered about Medicare and its coverage, you want to be very careful and check what actually it means about hearing aids are covered in a Medicare plan, right? So according to, let's go AARP, because a lot of people say, well, I've got AARP. And according to this, it says that things are covered. Well, I actually looked, and this is verbatim, so I'm going to actually read it because I want to make sure I say exactly what the website says. But AARP states savings on hearing aids and hearing care. Regarding that, AARP members can save up to 50% on prescription hearing aids and up to $200 off over-the-counter hearing aids. Members also receive, so if you just stop there and you're like, oh, I get 50% off my hearing aids, or $200 off if I walk into, a drugstore and try to buy something off the counter. So if you just stop there, then you would think that I'm just going to walk into an office and I get 50% off my hearing aids. But if you continue reading, it says members also receive a free hearing exam and consultation with personalized support through a large nationwide network of hearing providers. Again, I not only get hearing aids at 50%, I get a free hearing test and a consult. So with that information, I'm just going to make an appointment, right? However, if you keep reading, it says no insurance is needed to use the program. Visit the AARP Hearing Solutions provided by United Healthcare Hearing website for more information, and mention your AARP membership number over the phone, or call United Healthcare Hearing. So if you click that, I went and clicked it, it actually takes you out of AARP, and it does say, warns you, you are now leaving AARP website and you are entering United Healthcare Hearing, which is that third party that Dr. Galloway had briefly talked about, right? So if you look at the disclosures tab, there's actually a disclosures tab there. It states AARP benefits, I have to make sure I can see this, are provided by third parties, not by AARP or its affiliates. United Healthcare Hearing pays a royalty fee to AARP. Some United Healthcare Hearing offers are subject to change and may have restrictions. Please contact United Healthcare Hearing directly for details. So again, a little tricky, you guys, because you think that, oh, I've got AARP, I'm going to march right in, get a free hearing test, and hearing aids 50% off. When in actuality, if you follow their instructions to the T, it makes you leave AARP and you enter the United Healthcare Hearing portal site to make your appointment, to schedule the test, all that kind of stuff. So I just wanted to, kind of talk a little bit about that and just make sure you read all the fine print, or ask somebody, ask probably an audiologist office, because they'll also be able to educate you, like most of the times when we try to educate people here when they come in. So that was something that I wanted to talk about real quickly. Just be very, very careful. Okay, the next scenario here goes to Rebecca, I believe.
Yeah, I think we were looking at how often is it recommended for a hearing evaluation, and how often do I need to replace my hearing aids? The first thing to address is how often should I have a hearing evaluation? If you have hearing loss, we generally like to see you every year just to make sure things are staying stable, if there hasn't been any changes, and if you're a amplification user, that if there's been a change, we might modify or adjust your hearing aids slightly to accommodate that change. So it's nice to check in with you every year. And again, typically, if you are using insurance, that diagnostic test is covered every year. So why not take advantage of the insurance that you have signed up for and you are paying for, essentially? So might as well use that one. So that's a good idea every year. If you have healthy hearing, sometimes we push you out biannually, but if you ever suspect that, there's been a change, that's a good time. Even if we saw you 6 months ago and you feel like, man, something changed, it's a good idea to kind of come in and just reevaluate, and we can do a quick test to just check and see if things have been, if your concerns are validated. And then the other aspect is, if I am an amplification user, how often do I want to change my hearing aids? So most rechargeable hearing aids, that lithium ion battery, manufacturers say it'll last you about 3 to 5 years. And we do see that with most hearing aids. They are, they're covered for up to 3 years, typically with manufacturers. So definitely you should get about 3 years solid, good use out of your hearing aid without really running into any problems other than the typical use things like your wires or what I call the parts and pieces that are interchangeable. Your domes and your wax guards we talk about, you're going to clean those and replace those often. That's just part of the use of the hearing aid. But the internal parts or the housing and the casing of the hearing aid should really last you at least 3 years. If you're a bit rough on it, we're probably looking right at that 3 years. If you're in more of a humid climate where there's possibility of moisture, even though hearing aids are getting better and better with their IP ratings, those are just some of the things that can, maybe degrade the quality over time. If you've got kiddos, they might drop them, lose them, and all those things. But in terms of the actual function of the hearing aid, 3 years is really good. We've had a lot of manufacturers with some of their devices. We're looking and servicing hearing aids that are 5 to 7 years old. The only caveat with that is, of course, you're spending a lot of money. You want to get the best of your investment out of it. So you want to take really good care of it. But what we do see with manufacturers is about every 5 years, they're kind of no longer replacing parts on devices that are older than 5 years. What we're seeing is that they can't replace, like if a hearing aid comes in broken, it's 5 years old, they don't have a new one to give you. They have to give you a refurbished one. So then you're kind of in the realm of, things could go wrong at any point. So we try to encourage, about year 3, we like to send in our hearing aids just before their warranty to get them all kind of spiffied and cleaned up for you to make sure you get another good couple years out of them. But then about 3 to 5 year range is when you start to think, okay, I need to maybe start saving some money or putting some stuff aside or looking for an insurance carrier that will have a better benefit for my new next purchase. So that's kind of the target range we say. If you're a real tech savvy person and you like to always be on the cutting edge, then about every 2.5 to 3 years, manufacturers are putting out new devices with new things and new updates and things like that.
All right. So we have another question too. So this is kind of back to the one that I covered earlier, but I have a benefit for hearing aids. How can I use it? What does the allowable amount mean? So the allowable amount, it's going to be different between each plan, each company, all of that. But essentially what it's saying, so I'll use hearing aids as an example. If they say the allowable amount for hearing aids is $5,000, that means they will only consider paying for hearing aids that cost $5,000 or pay towards that $5,000. And then after that, you either have to pay above and beyond if you wanted to get a set that costs more than $5,000. You can sign a waiver and that kind of thing. What's interesting is that the allowable amounts aren't usually listed anywhere, and you have to ask that question. And usually, if you call in, they don't actually know. They have to look it up, and sometimes I have to give them the codes and all of that. The allowable amount was another thing that I was seeing with the dental industry, and they're making all of these. This is how much it costs, but only this much is allowed by your insurance. So it's hard to kind of know what's exactly going to be paid, but our best advice is to ask a lot of questions, call, get specific codes for the hearing aids. Okay, if it's V5261, what's the allowed amount on that? And being able to have all this information helps us to know kind of, what to predict. But it's really different between each company. And some patients have more than one insurance policy. So, some patients have multiple policies. And so maybe one doesn't cover it, but we need to look at another one, or you can, bill them both. So really, we're happy to look into your specific situation. If you come in and see us, we'll check your insurance. We'll see, kind of what we think is going to happen with the benefits, and then go from there. But really, asking questions is kind of your best thing to do, because it's not super clear. And talking about the AARP, we had somebody this week that was like, oh, no, I'm sure mine has hearing aid benefits because that's why I took it out. And there's not, and not with us anyway. It's what Dr. Phillips just read about, going someplace else and all of that. So it's not always as clear as it seems. And, you have to read the disclosure statements and the fine print to kind of get the full details.
Yeah, it's a learning curve, I think, for everybody involved, because not only did we learn some lessons, but things change. And so from like year to year, like we have different codes we have to use to bill, right? And, there is constant discussion on our audiology boards about things. And insurance has changed things as well. Like that's why we had to leave Blue Cross, because they changed both the federal and the state options for some of our patients. And it was something that we just didn't agree with. And so, I think the best advice is what Dr. Galloway said, is to ask questions when you come in. If it's our office, if it's somebody else's office, if you want to call us about somebody else's office, we'll tell you what we know. We'll try to help out. Or like we said, if you've got comments or questions, post it here in wherever you're watching it, whether it is on Facebook or on YouTube or on LinkedIn, and post your question there, and we'll try to see if we can get the answer for you. So hopefully that was helpful. I know that this was a little more educational, but it's something that we definitely wanted to provide for our patients. And, we'll be back. Like I said, we'll do it once a month. So we'll go probably a little bit longer than we have, but hopefully we'll get some good information out for you guys. So if you have any other questions, you know where to find us, and just send us a message and let us know. But other than that, we will see you guys next month in February. All right, we'll see ya.
Thank you.